Dental Office Emergency Case Study Project, Asthma Attack, by Gianna Monsiváis, Thu Lee, and Surya. Patient arrives 15 minutes late for appointment. They state their schedule has been extremely hectic that day and they are stressed. They apologize for the inconvenience but must be seen as they are getting married over the weekend and need their teeth cleaned. 15 minutes into the cleaning, the patient begins to cough and an asthmatic attack occurs. The clinician is patiently waiting for her patient to arrive. The patient arrives 15 minutes late for her appointment. She explains that her schedule has been extremely hectic that day and she is stressed, and apologizes for the inconvenience, but must be seen because she is getting married over the weekend and she needs her teeth cleaned. The clinician reviews the medical history. She notices the patient has a history of asthma and questions the patient to see if she brought her inhaler with her to her appointment. The patient says she forgot it as she was in a rush. The clinician lets the patient know that she's going to grab the inhaler from the medical emergency kit. The clinician brings back the inhaler and puts it on the counter and lets the patient know that if she needs to use it, it is available. She then proceeds to take vitals. Asthma is a chronic respiratory disorder in which there is increased responsiveness of the trachea, bronchi, and bronchioles to various triggers, resulting in the narrowing of the airways. Asthma is a complex disease that is influenced by multiple genetic, developmental, and environmental factors. In the dental office setting, stress-induced asthma or an allergic response to a dental material may result in an asthma attack. The airways of asthmatics become hypersensitive to certain triggers known as stimuli. 15 minutes into the cleaning, the patient begins to cough and an asthmatic attack occurs. Symptoms of asthma attack include respiration rate is slightly faster than normal range. Complete sentences can be spoken. Mild to moderate complaints of wheezing, cough, shortness of breath, or tightness in the chest. Also, the skin color of the patient may change. During an asthmatic attack, tight clothing should be loosened to facilitate breathing. Sit the patient up in an upright position and give them the inhaler and administer 2 puffs of the medication. You may also administer 4 to 6 liters of oxygen per minute with a non-breather bag and monitor vital signs. If it does not subside within 15-minute intervals of albuterol, EMS should be contacted. You should also recheck the patient's vitals. Asthma is a chronic respiratory disorder in which there is increased responsiveness of the trachea, bronchi, and bronchioles to various triggers, resulting in the narrowing of the airways. The airways of asthmatics become hypersensitive to certain stimuli. In response to the stimuli, the bronchi contract into spasm, resulting in difficulty breathing. Inflammation leads to a further narrowing of the airways and excessive mucus production, which results in coughing and wheezing on expiration and inspiration. There are 5 types of asthma. Extrinsic asthma, most common type with most patients demonstrating an inherited allergic predisposition. Triggers are from outside of the body and include pollen, dust, mold, etc. Intrinsic asthma. Episodes are precipitated by non-allergic factors such as psychological and physiological stress. Drug-induced asthma has been seen in some patients. NSAIDs are considered triggers along with metabisulfite. Exercise-induced asthma. Symptoms typically begin shortly after the start of exercise, resulting in severe bronchospasm, usually linked to children and young adults because of their higher level of physical activity. Infectious asthma. Viral infection of the respiratory tract is the most common. Signs and symptoms. For a mild asthma attack, respiration is difficult. The respiration rate is 14 to 20 breaths per minute. Complete sentences can be spoken. Mild complaints of wheezing, coughing, or shortness of breath. Skin color is good. Moderate asthma attack. Respiration is moderately difficult. Respiration rate is faster than normal range. Moderate complaints of wheezing, coughing, or tightness in the chest. Skin color is normal or may be pale. Severe asthma attack. Respiration is labored. Respiration rate is very slow. Only single words or short sentences are spoken. The skin color is poor. Preventative procedures. Focus on maintaining the patient's respiratory status to as close to normal as possible, limiting exposure to known allergens, limiting exposure to identified triggers, the use of bronchodilator therapy and corticosteroids. Treatment options. Prevent acute episodes. For uncontrolled asthmatics, they should use their bronchodilator prior to their appointment. Access to bronchodilator during appointment. Treatment should be terminated in patients seated in upright position with arms forward. Tight clothing should be loosened to facilitate breathing. 2 puffs is recommended dosage. You may supply oxygen at 4 to 6 liters per minute via a non-rebreather bag. Monitor vital signs. If attack does not subside, additional doses of albuterol should be administered at 15-minute intervals, and EMS should be contacted.